right, Dr. McCullough, thank you so much for being here.
Thank you. We overcame the tech issues. Great to be on.
Perfect.
Awesome.
Good, good, good. Okay, here in Washington, stuff is blooming out the yin-yang. Pollen is everywhere. I hear so many people sniffling and snarfing and coughing and huffing. And then I hear about people getting the flu, but it seems like people are a little bit more reticent regarding the flu vaccine. Are we all in good shape to just kind of slide through and hope that our bodies take care of it as far as our immune system?
It was a particularly severe flu season. It's essentially over. The flu vaccines didn't work. That's one of the reasons why we had a higher case count. But people are through this now. We recommend nasal sprays and gargles twice a day. Wellness Company has Immune Mist. That's fine to use. Everybody should do it twice a day. I just flew yesterday on the airplane. Let me tell you, 300 people on the airplane, somebody is carrying a virus.
Definitely true. Definitely true. That's what makes those products so great. Sir, you've been talking about some interesting new developments. It used to be a dirty I word, ivermectin, but today it's coming back into fashion the way it used to always be. Ivermectin and membedazoline. I think I made a massacre.
You got it.
But the new off-label potential for that. Talk a little bit about what you're seeing there and maybe some openness in the scientific community. Go back to science and not politics.
First, let's take the on-label use of ivermectin and mebendazole. They're antiparasitics. You know, the CDC has been telling us for years that parasite infections are probably underdiagnosed in Americans, particularly sushi eaters, people traveling. We have so many different circumstances. Those drugs are indicated for parasitic infections or even what's called a parasite cleanse when they're suspected and we can't nail down the genus and species. But the off-label use now, based on growing amounts of critical information, is actually in cancer care once everything else has been done in terms of conventional treatment.
Wow, that's incredible. Huge. I want to go back to the parasite thing for a moment. I also heard from a veterinary friend of mine that if you let your dogs or cats lick you on the face, then you're also probably at high risk for some type of parasite. Do you think that it's wise? Is it just a good health protocol to do a parasite cleanse, even if you don't really know if you have one?
The CDC characterizes these infections as difficult to diagnose or underdiagnosed. Patients should see a doctor, have formal parasite testing, what's called ova and parasite testing. However, there are certain infections, particularly the waterborne infections, that really essentially aren't readily diagnosed. So, drinking stream water, for instance, getting abdominal pain and diarrhea, I can tell you that's probably Giardia. Go eat sushi and end up having abdominal pain, cramping, fever, weight loss. It's almost always a parasite infection in the salmon, believe it or not. So there, an empiric use of a parasite cleanse under doctor's direction at the Wellness Company is very reasonable.
Doctor, you've been writing so brilliantly on Substack. I read all the time. You've had some really interesting observations about the early tenure of U.S. Health and Human Services Secretary Robert F. Kennedy. He's addressing the rising prevalence of autism. He's reorganizing the department. Today, President Trump got rid of gain-of-function research, something I know you're going to be happy about. Could you give us a little sense of what you think this administration is off to on the health front?
Boy, the first 100 days have been like a whirlwind. Things that were low-hanging fruit were these food dyes, which advocacy groups have been wanting to get these out of the food supply for years now. Finally, they're gone. The CDC dropped a bombshell in terms of the autism epidemic, and RFK used the right word. It's an epidemic, and now an all-hands-on-deck investigation into what are the risk factors for autism. We've got to slow this down now. Profound autism, which means an IQ less than 50, 24/7 care, can't use the bathroom unassisted. That's now 27% of the entire autism spectrum.
Wow.
That means states like California, 1% of children are that severely affected.
God, this is profound.
I just want to start back where we began with regards to the gargle and the nasal spray. I know a lot of people are going to have questions about that. They can find that on the Wellness Company website.
Yeah, Wellness Company features Immune Mist as a set of products, but there are a whole range of products. Some of my favorites outside the wellness company include Clear, Xlear, and Spry, Spry. It has to be comfortable. It's got to be done every day. Don't wait until you're sick.
Absolutely.
That's really smart. The emergency kits have ivermectin in them as well, right, sir?
Yeah, our emergency medical kits have the ivermectin, hydroxychloroquine, azithromycin. The field kit, John, you would probably like that. It really has the largest array of antibiotics and other critical drugs, particularly as these trade negotiations with China wear on.
Yeah.
We are concerned about constraints of the drug supply.
That's a really great point.
All of those kits are wonderful. We started with the blue one, but we intend to get more, especially the travel one, because we plan on traveling. My boss doesn't know that yet, but we do plan on it. All right, everybody, go to twc.health/justnews to get your wellness kit today, and you can save 10% by using promo code JUSTNEWS. That's twc.health/justnews. Use the promo code JUSTNEWS to save 10%. Dr. Peter McCullough, always a joy to have him here. He always has such great wisdom. All right, everybody, from the Wellness Company, we'll be right back after this.